Hey team, I've had several requests come through for some tips and tricks to help with some neck stiffness and pain, a very common dysfunction that is occurring with all the time spent down, dropping and looking at the phones, computer screens, etc. So here are some tools that you can implement on a daily basis or every couple of hours if you need to really break up that static posture and get yourself moving and feeling better. The first one is some joint mapping of the neck. So we're going to place our hands on our chest to stop our chest moving so much. We're going to focus on moving our chin forward and backwards. So we're going to drop that chin all the way forward and then pull that head all the way back in and out in that position. Now, if you find yourself getting to here and it's causing pain in that neck, then stop a few centimeters before that position and just move in and out of a pain-free range. It's very important when doing these drills to stay out of pain. We're trying to teach your brain to be happy with any movement that's occurring, and over time you'll be able to increase that range. The next drill is then moving forward onto your jaw. You'll very much find that the relationship between the neck and jaw presents with a lot of dysfunction in both. So here we go. With our jaw, we're going to start off with some jaw glides, forward and backwards. So we're getting that jaw to glide all the way forwards nice and slowly and carefully, and then all the way back up for about 5 to 8 repetitions. After that one, we're then going to slide our jaw side to side. Again, about 5 to 8 repetitions there, avoiding pain, but just feeling that jaw moving and how much tension you will find in through your TMJ joint, etc. After that one, we're going to look at some additional soft tissue release work. And we're going to give you 2 drills today for that one. The first one is to come up in front of that mastoid process, so just behind your ear. We're going to place our fingers up there. Now, you're not going to be able to go hard in this one. It's just soft, and it's just using my 2 fingers just to do a little bit of pressure in there at a point that is bearable for you. So on a scale of 1 to 10, 10 being unbearable, we're looking at about 4, maybe 5 at absolute most. So it's a little bit uncomfortable, but you're not in pain. And we're just going to be gliding and just rubbing those fingers in through that position in small little circles, and just slowly just dragging our fingers down after a little bit, just to help release a lot of that connective tissue that sits in through that area. The final piece of the puzzle is getting yourself a towel, and we're going to wrap that through our suboccipitals. So sitting at the base of our skull, we're going to push that towel up underneath the base of your skull, and we're going to then just pull that towel up. Now, as I pull up to the right with the base of my skull resting on that towel, my chin naturally just slides across to the left. So I pull up, I'm just having a little bit of a head bend, my head's just dropping back slightly, I'm staying away from pain, and I'm just pulling that towel across the base of that skull, along the occipitals, and just feeling a very gentle, passive stretch of the occipital muscles, but more importantly, all the fascia and connective tissue that sits around there and then joins onto the base of the skull. So we want to get the joints moving through a pain-free range of motion. We then want to stimulate some tissue release so that that tissue then starts to relax after having started to move the joint a little bit. And then the final piece of the puzzle is just getting yourself back into a strong standing position. So from here, don't think about sucking your chin in and squeezing it through the heart and generating extra muscular tension. What we want to try and do is think of ourselves standing nice and tall. So imagine a piece of string on the top of your skull, and from there you're just going to imagine that that is just gently pulling you up nice and tall. You'll naturally find your chin will come back, and really lifting that up is just going to help lengthen that spine. You'll also then very much find that the tension through here is going to be related to the tension through your thoracic, through to the tension of your lumbar, through to the tension in your pelvis, and also how your glutes are functioning. So it then starts to really give you some awareness of a whole body approach being needed to really fix this solution long term. But to get you out of some pain and dysfunction here in the intermediate area in our time, then release and activate and get yourself back into a good position, and then start to look at the rest of the body to really give yourself that whole body approach, which will generate that long-term results that you need.